suite, and just wanted to give everyone a heads up on the procedure that we will be performing at this time. We presented this case earlier this week. This patient, we're going to be performing bilateral left and right bunion corrections. Okay, she's got a bunion on the right, bunion on the left. We're going to be correcting the hammer toe. She's got a small little tailor's bunionette. We're going to definitely take care of that as well. And, most importantly, this patient, again, as previously mentioned, has, bilateral flat feet. These are flexible flat feet. And I will go ahead and talk a little bit more, and then I'll edit it into the video at the end. What we did today and why. With a little bit, more background. So really everyone understands, for all of the people out there in this world that are battling, flat feet, there are solutions out there. I don't want to say, minimally invasive, but we can say it's a more of a hybrid minimal approach. So we can definitely elaborate a little bit more. So if there are any individuals out there that are battling the symptoms that come along with flat feet, there are long-term solutions. And again, we will be performing all of these procedures under local anesthesia. The patient will be awake, and I'm looking forward to this wonderful case. I will keep everyone afloat. Again, like always, stand by. It's the continuation to the original video. So we're all done with all of the procedures. Dr. Orlando Nunez and myself performed quite a bit of work here today. Let's go through each foot separately, because on the right foot we did one extra procedure. So right now the entire foot is a little bit swollen, even right after the procedure. The patient had, just to refresh everyone's memory, we had a bunion here, and right now all of this is basically is empty. There is no bone. So I'm going to show everyone. Okay, can you see from the top here, Sebastian, please? So that's, the bump is gone, and I'm just basically this is all empty space. So if we go like this, and again, all of this is all empty. So the bunion was corrected, and we also shaved a little bit on the top. She did have a couple little bone spurs that were also there, so we went ahead and took the opportunity to do that. Let's take a look at the side of the foot here. So again, same thing. If I go like this, everyone can actually, this is all empty space here. So if I kind of go like this, everyone can see that, we basically just shaved down that bony prominence, what we historically call the tailor's bunionette. The toes, we corrected the hammer toes. They're nice and straight now. They're already splinted, as previously discussed in some of our other videos. We use steri strips, whether for toe shortening, for digital procedures. This is how we keep everything in place for several weeks. Again, one little stitch here. I want you guys to take a look. Come through the bottom here. This is where the magic really happens. There are no stitches here, so this is where the magic happens, right? When we talk about, minimally invasive, this is the true definition of minimally invasive. Not only that, we're able to in this case, accomplish the correction of the hammer toe through the bottom of the foot. How wonderful is that, right? And again, the same thing goes for the bunion. I'm just gonna come around here and just show everyone here the little stitch that we have right there. So we're able to correct, whether it's only in all of our bunion procedures. In this particular case, we didn't have to shift the bone, the great toe this way. So usually, or historically, you may see a little stitch here, or maybe a stitch here, maybe a tiny little stitch here. But the point is that we're able to basically do everything via these little tiny keyhole incisions. Now, for the grand finale, so to speak, it's still oozing a little bit here, but we were able to correct the patient has a flexible flat foot. And during the procedure, we were talking, Dr. Nunez and myself, that this procedure is so wonderful for a lot of reasons, right? Let's go back here, Sebastian. So basically what we did was, just like I told everyone in before at the beginning of this video, the patient has a flexible flat foot. And there's a lot of people out in this world with flexible flat feet. And, you know, the patient is very young. She's 25 years old. And from a prevention standpoint and from a functional standpoint, this procedure that we performed is a home run. Pain relief, more than anything, and prevention. Prevention from what? Well, in the long run, maybe 25, 20, 15 years down the line, you know, there's a possibility that the patient may end up with something that we call dysfunction of the posterior tibial tendon. And, you know, that's extremely uncomfortable. The tendon that holds the arch on this side of the ankle can actually suffer and degenerate throughout the years to come. So we basically put a little implant into that joint, a specific joint called a subtalar joint. And it's such a wonderful procedure. You know, would you call this minimally invasive? Sure. I mean, it's 2 little sutures versus, you know, a big incision or other procedures that other, you know, possible surgeons may possibly recommend. But for 25, even for older individuals, we're able to use this procedure to accomplish the desired effect and outcome. Let's take a look at the left. You know, quite a lengthy video that I'm putting together, but I really want to explain to the public, right? Same thing. This is all empty space, as you can see. So that's, the bump is definitely gone. Looks absolutely wonderful and beautiful. And then, you know, the toe is nice and straight, right? We call it the shrimp. Nice and straight. We didn't do anything here. And again, we basically performed on this. We also performed, you know, a little bit of oozing. This is totally normal. And this is probably also a little bit of PRP. We did inject already the platelet-rich plasma. We already injected the platelet-rich plasma. We isolated that, and we injected that into all of the areas where we performed all the procedures. Just to refresh everyone's memory again, PRP, platelet-rich plasma. We isolate the liquid gold, so to speak, where we have the growth factors and important cells that aid in, you know, reducing the inflammation and the regeneration of the trauma in this case, right? And again, just last but not least, I just want to show everyone underneath the left, same thing, one little suture here. I mean, how wonderful is all of this, that we can actually accomplish all of this, you know, keyhole incisions, in-office-based surgical suite. Patient is wide awake. She's a little bit, you know, loopy, just because we always want to make sure that our patients are very comfortable throughout the procedure. And I'm going to go ahead and ask the patient, how did everything go today, patient?
It went good.
How do you feel?
A little bit sore, but
Okay.
for the most part, I'm okay now.
The patient feels a little bit sore. The anesthesia, the local anesthesia, is probably wearing off at this point. But she did otherwise great, and she's still a little bit loopy as well, which is a great thing. Okay. Again, correction of bunion. Just a quick recap: correction of bunion, Taylor's bunionette, hammer toe, and you know, I think again the most important, just because we really haven't shown this procedure in any of our videos, is the subtalar joint implant for the correction of the flat feet or flat foot, flexible. I want to take this opportunity to thank the patient. Number one, I want to take this opportunity to thank Dr. Orlando Nunez, who is here with us. We continue, as everyone knows, in all of our social media platforms, we're continuing to basically educate the entire world that minimally invasive foot and ankle surgery does exist. Number one, that we can accomplish these procedures using really progressive and modern techniques, which is extremely important. That's our goal. At the core, that is our goal, to tell the world, to show the people from all walks of life anywhere that minimally invasive foot and ankle surgery does exist. A lot of people don't know that. I would say 95% of the entire world, or even more, they don't know this. So that's our goal, to educate, and that's extremely important for a lot of reasons. I want to take this opportunity to thank all the viewers. I hope you guys have enjoyed this case study. I think it's really, really nice, and more importantly, I hope that again, these are alternatives versus maybe your possible open traditional approach or surgical approach. So like always, www.jawspinedger.com, www.cdafootandAnkleClinic.com, our YouTube channel, Jaws Healthcare. We will be doing some changes along the way, and I will keep everyone afloat. Obviously, we will be integrating a lot of different great